Hi, my name is Emily Craig, and I will be sharing my behavior change project on the behavior of gossiping. So, first, I want to talk about my participant. My participant is a 23-year-old white female named Ella. Ella is employed full time and enrolled in a master's program. She was diagnosed with anxiety at a young age and has no behavioral deficits. So, the behavior of concern I want to talk about is gossiping. This is a more complex behavior, so the definition is a bit long, but I feel like the whole definition is important. Gossiping is defined as any instance in which an individual makes a comment about a target person who is not currently present or is unaware of the conversation to another individual. The comment involves private events that are about the target person that are not factually verified. An example would include saying, I think that our boss is not putting her effort into her work to a coworker. A non example would include saying, the boss said to do the work like this to a coworker. Onset is the moment that the comment begins, and offset is once the participant stops talking or starts talking about another topic, or if another person starts to talk. One conversation exchange equals one instance of behavior. This will be my dependent variable for this project. So the social significance specifically for Ella is gossiping is happening a lot at her work, and it's causing a lot of tension between coworkers and the leadership. And consequently, because she works with clients, this is affecting their treatment. So this could become an ethical issue if it is affecting the client treatment. And as far as measurement, I'll be measuring the repeatability using rate, and this will be the instances of gossiping per workday. The IOA was obtained by her coworker once a week while they were at work together. So this was about 25% of sessions. The FBA process that I used was I first did an indirect measure of doing the functional assessment screening tool or the FAST. And I did some direct measures by doing a trial based functional analysis and collecting baseline data on her gossiping behavior. So these are the graphs for the FBA. The FAST showed mostly the highest score was social positive reinforcement in the form of attention, with a secondary function of maybe a social negative reinforcement for escape. So for her gossiping per day, you can see with this graph that there doesn't appear to be a trend, and there seems to be pretty moderate to high variability. But the level does seem to be pretty high, except for that one little off day on session number 4. So for the trial-based FA, as you can see in the graph, it was pretty obvious that attention seems to be the function of this behavior, specifically socially mediated access in the form of attention, social positive reinforcement. The ignore condition showed moderate levels of the behavior, but I believe that attention is the primary function of this behavior. So for my intervention, I will be using self-monitoring, a DRL or differential reinforcement of low rates of behavior, and a DRA or differential reinforcement of an alternative behavior. So I kind of want to explain the experimental design. So first I'll be using an ABAB design. The A part is baseline. So I will reverse back to baseline for the second A. During B, she will be having every piece of that intervention in place. So that would be the DRL, the DRA, and the self-monitoring. For generalization, she'll talk to multiple people in many rooms at her workplace. And for mastery criteria, she has to engage in 2 or less instances of gossiping per workday for 5 workdays in a row. Maintenance is she has to self-monitor once a month. And I do kind of want to go back and explain each of these pieces. So the first piece is self-monitoring, and this one will go along with the DRL. So she will have to record her instances of gossiping per day. and she'll be given a rate that she needs to stay beneath. So for the average of her baseline data, it was around 8 instances of behavior per day. So we want her to stay underneath that for her DRL. And that will continuously get lower and lower. So hopefully she will be motivated to stay underneath that and decrease gossiping that way. And then alongside that, she'll have a DRA of also obtaining reinforcement, extra reinforcement whenever she engages in appropriate conversations with coworkers and the experimenter and the coworker that is collecting the IOA data. So because this is a behavior that the reinforcement from gossiping cannot completely be taken away, I'm adding the experimenter and her IOA observer. They are both going to be giving extra reinforcement to Ella whenever she is engaging in appropriate behavior, so that hopefully this extra reinforcement that she's not normally getting, which is pretty much they'll just be really engaged in the conversation and providing a lot of attention. Hopefully that will be more reinforcing than the reinforcement that she gets from gossiping in her natural environment. Okay, so the next part is the results. As far as you see, so baseline, that was the data that I had talked about for the direct assessments. But in intervention, you can see that the level is pretty low and possibly has a decreasing trend. It's hard to tell because this one is kind of messing up the trend. But the variability, I would say, is probably moderate. It's not too bad, but not completely stable. So for baseline, going back to baseline, it goes back up to a high level. The variability is probably moderate, and there does not appear to be a trend. And then for the final intervention stage, no apparent trend, possibly again a decreasing trend right here at the end, but there would need to be more sessions completed to see if that is the case. And I would say there's a moderate variability, but I think Ella is in a good spot. So I would say that this intervention was successful. So her level after the intervention is more socially acceptable. So the data implies that this DRA intervention, DRL intervention, and self monitoring could be successful for complex verbal behaviors like gossiping, or could be successful in decreasing those behaviors from an OBM perspective. As far as my discussion goes, so some strengths that I believe were in this intervention where it was informed by peer-reviewed literature. So there's not much literature on gossiping specifically, but there was a lot of literature on complex verbal behavior. So I really leaned into that. And then I read a lot of OBM articles just on behavior management within a workplace. And then I also think that this should be a smooth transition to fade out the intervention, because self-monitoring is something that does not necessarily need a interventionist to be providing reinforcement for. I think that Ella could definitely do this intervention outside of me implementing it. For limitations, I think that it's possible that the coworker's reinforcement could be more effective than the experimenters. And this is just hard to tell. If there's a lot of drama going on at her workplace, then that gossiping behavior tends to increase. And I think that that could be more reinforcing at times than the positive self-talks, positive talk with peers and coworkers. So that is something that would need to be monitored and adjusted as the experiment went on. And it's also hard to tell if both interventions work together, or if one intervention was effective and another wasn't. In order to do this, I would need to break apart each piece of the intervention just to see how it affected her behavior. But due to time, I did not end up doing that. And these are my references, 2 pages of them. But thank you. That is my presentation.